When we think of post traumatic stress disorder or PTSD, also known as shell shock, our minds are directly focused on U.S. veterans, which is a common misconception that only soldiers can have PTSD. PTSD can occur in all people of any ethnicity, nationality, culture, or age. PTSD affects approximately 3.5% of U.S. adults. An estimate 1 in 11 people will be diagnosed PTSD in their lifetimes. Women are twice as likely as men to have PTSD, according to the American Psychiatric Association. We're going to discuss briefly the causes, the treatment, the diagnosis for PTSD. One thing we must remember is PTSD is not about what is wrong with you, it's about what happened to you. Post traumatic stress is an anxiety disorder that can occur with anyone who has experienced a traumatic event that threatened death or violence, such as rape, other type of abuse, serious accident, natural disaster, military combat. For instance, my brother was diagnosed with PTSD after serving in the Desert Storm War. He retired after 20 years in the Army. He explained to me how a bomb blew up behind their humble truck and his partner was killed. A steel piece of pipe struck him directly in the head, and a surgeon had to implant a device to keep him alive. He also stated how it is hard to deal with depression, sleeplessness nights, night sweats, and nightmare, and almost impossible to be in or around crowds. So I asked him, what are you doing about it? And how is your wife handling your mood swings? He told me he takes medication, counseling, and take it life one day at a time. And with his wife, love and support, they are doing okay. According to the Mayo Clinic, most people who go through traumatic events may have temporary difficulties adjusting and coping, but with time and good self-help care, they can get better. Some of the PTSD symptoms are reliving the trauma event, like flashbacks, avoiding places, activities, or people that remind them of the trauma event, negative thoughts about yourself and other people of the world, feeling detached from family and friends, lack of interest in activities you once enjoyed, feeling emotionally numb, irritable, angry, outbursts, or aggressive behavior. Children and teens can have extreme reaction to trauma, but their symptoms may be the same as the adult. If the symptoms get worse, last for months or maybe years, and interfere with your day-to-day function, you may have PTSD. In diagnosed post-traumatic stress disorder, your doctor will likely perform a physical exam to check for medical problems that may be causing your symptoms. Do a psychological evaluation that include a discussion of your signs and symptoms and the events that led to these signs. Use the criteria of the Diagnostic Statistic Manual for Mental Disorder. The treatments involve psychotherapy, counseling, medication, or a combination of both. The psychotherapies are continuous progress therapy, group therapy, and prolonged exposure therapy. Medication can help control the symptoms of PTSD. Also, the relief from the medication allows many people to participate more effectively in the psychotherapy. And depression, they are used either alone or along with the psychotherapies or other treatments. People with post-traumatic stress disorder presented with a range of symptoms, the cause of which may be overlooked or misdiagnosed as having result from past trauma. If you are in doubt about your illness and believe it to be PTSD, consult a doctor or therapy as soon as possible.